Hi, this is Dr. Neal Schwartz. Today I have an incredible case from the Acne Practice to share with you. My intention of this video today is to help alter our entire healthcare system and our culture in regards to chronic conditions, specifically the condition of acne. So without further delay, I present to you severe acne treated without oral medications, lasers, or dietary restrictions. Here we go. In September of 2012, I received this slightly unfocused, severe photo of a young woman suffering from acne. The email was from her mom, and we had already previously spoken on the phone about her daughter. Hi, Dr. Neal. I spoke with you recently about my daughter. She has had a long battle with acne, and we have tried many things to remedy it. Just to name a few: Proactive Obagi, many over-the-counter cleansers, Clear Now by Amway, herbs, diet, topical antibiotic cleanser from the doctor, facials, etc., etc. We are so upset about not being able to find something that will permanently handle the situation. Recently, a family friend said that she could handle acne no problem. When she saw the pictures, she told us that this was a very bad case and that she wouldn't be able to do anything for us. We have been looking at your videos, and I believe my daughter is now going to move forward with your program. I am enclosing photos from September 3rd, 2012. These are the same photos we sent to the esthetician who made that remark and to the doctor who was offering the photo laser, who said there are only two things that would handle this cystic acne. One is Accutane and the other is photo laser. Thank you. This is the email I received. She spoke to an esthetician and a doctor. Both believed that treating severe cystic acne topically was an impossibility. It was their strong belief based on a misconception that has been around for 30 years. My intention today is to use hard evidence to change misconceptions in regards to acne and in regards to chronic conditions in general. Let's start with the evidence. This is the right side, week 1. Let's take a look. By the way, this client participated incredibly and was taking photos every other day and sending me all kinds of photos. So we have a ton of evidence in this particular case, which is amazing for us to study scientifically and to help convince other practitioners, doctors, and scientists what is now possible with the condition of acne. So let's take a close look. Obviously, the activity is very thick in here, and we're seeing that acne on top of, pimples on top of pimples here. We have flakiness, and we see a ton of red marks. You see a lot of wear and tear, and obviously that's very scary to see on someone who's still active, meaning she's making new scars and she has prior wear and tear from earlier this year. This was in the first week. This is week 3, and you can see she still is active, but things are starting to get dark and dusky and dull, more dull looking, and they're looking more calm. During this shot, she's less uncomfortable. Her face is starting to get less oily and less juicy and less tender to the touch. This is week 3. Here we have week 5, and you can see, aside from right there and maybe smaller ones that we're not picking up with this level of focus, the activity is way down at week 5, and we're now looking at a lot of flat dark marks and three-dimensional scars with dark marks in them. It looks much more comfortable. It looks much more matte finished. And at this point, she probably knows she's going to get all the way better because her face is more comfortable. And a lot of times the comfort in your face will tell you a lot of things about how you're progressing. This is week 8, and you can see she's already emotionally and medically speaking healed. We are now dealing with the cosmetic aftermath of having an inflammatory condition on the face uncontrolled for many, many months. And so this is just the cosmetic wear and tear that we're seeing here. And at the end of the 2nd month, this is what we would call medically inactivated for the most part. I'm sure if we got a little more focus, there might be some small bumps in there, but for the most part, her focus captures what's going on. And so there's a little bit of redness right there. It's still kind of that dark redness, old redness. Okay, moving on. This is Month 5, this is the photo I recently received, and you can see not only is she inactivated, but her dark marks have faded beautifully, and even her three-dimensional scars have softened. She still has done some wear and tear to her face, but it softens over time only when a client is fully inactivated. And in this case, I'm not even seeing a lot of the smaller bumps too. This is also a good case to show three-dimensional scarring healing in the practice as well. In the practice, we heal active acne, and we heal dark marks, and we heal three-dimensional scars. But there is a stepwise process. We can't really talk about dark marks and scars and three-dimensional scars while someone's skin is still activated, because they're still making new dark marks and new scars. So it's a stepwise process. Let's see, this is the right side. Let's see from month 5 to week 1 again in comparison. Heavily active, heavily thickened, heavily oiled, flaking, dark marks, red marks, and three-dimensional grooves showing and very much visible. And this is where she is now. Emotionally, you can't say enough. In my opinion, this is a life or death situation. If she did not get fixed here or somewhere else who knew what they were doing, her life is seriously in danger with this amount of activity on her face. And here she's safe. She's safe to take on her other challenges of life. She's safe to take on her career. She's safe to take on relationships. She can take on life like this as a healthy human being. So that was just the right side. Moving on, like I said, she took a lot of photos for us. Let's look at the rest of the evidence. Here's the left side. Week 1, you can see how deep some of this activity is, how cystic it is. You can see some of these lumps coming on the front of her face. She has a ton of tiny bumps. She's got some flakes, dark marks, red marks, and three-dimensional scarring. This is week 1. This is week 3. You can see a lot of those lumpy bumps have turned into scabs, and she's a little dry here, but also she's a little what we call crusty. Some of those large bumps have almost crusted over, and they're almost going to fall off like a scab. And that happens sometimes when you have a ton of activity. It can dry up and almost look like a big crust. And that's what's happening over here. Here you have some of her old bumps pressing out. You can tell they're old because they're a little darker and duskier, and the rest of her face is so matte finish that you can see she's heading in the right direction here. This is week 3. This is week 5. Some of the crust is easing off here, and you're starting to see the same look of that flat, dark, and grooved areas. Much less activity. More that catches our eye here is the red marks and the three-dimensional scarring. Focus is not perfect here, but you can see that she has captured what's going on with her right here. You can see a general matte finish as well. This is again at month 2, and you can see, aside from a little bit of over dryness right here that she corrected by communicating with me, the rest of her skin is softening up, a little bit of activity here, and it's got that dark, dusky look to it again, so it's starting to look like older bumps and just stuff that's just trying to finally clear. The rest of this has completely flattened, and we are looking at a almost inactive cheek here, with even the dark marks have already started to fade here at the end of month 2. And here is her today, 5 months later after starting the program and after being told that it was impossible to treat topically. Here she is. Let's take a look. You can see she still has remnants of the 3D scars, but because they lack that darkness in them and they're starting to smooth out, that aesthetically they just soften up. So those who have serious three-dimensional scarring, you don't have to panic. Time will soften it if, and only if, you are not heavily active with bumps, or active at all with bumps. Even the small bumps can make scars as well. If she had a little better focus, we might be able to see some of the small bumps she still might have here, but as far as large inflammations, we are not seeing any of that. Even medium inflammations, we're not seeing much of that either. This is like the remnant of the remnant red marks here with maybe a tiny bump in there. This looks amazing. Let's compare that to the left side when she started. Let's get in there. This is pretty dramatic. Again, she was told by 2 professionals that nothing topical could touch this, and here we have the evidence that shows that topical acne treatment can take down any degree of severity of acne. And the evidence speaks loudly. This is not my opinion at this point. I'm just presenting evidence. All right. Like I said, she was doing great with taking photos. Let's move on to the next pieces of evidence. Look at this shot right here. Incredible shot for before. You can see dozens and dozens of tiny bumps in this area right here. Maybe if I zoom out, you can see me even better. See all these tiny little pearly flesh-colored bumps? Those are all little tiny pimples. Those aren't goosebumps. Those are tiny pimples. And then, of course, she has the larger ones coming all around. You can see the ones on her face even from this angle, three-dimensionally. And here we saw that other area that was very deeply cystic as well. This is week 1. This is a few weeks in. You see an incredible amount of inactivity and the red marks starting to show. And here's her at month 5. And it's obviously dramatic. You can see the shape of her ear and the shape of her jawline that this is the same person. And you can tell from the focus that it's untouched. This is incredible. For those who think they have hormonal acne or quote hormonal acne, this case should help bring a little hope to your situation as well. Please inform your doctor of what's going on in this practice. Enough people have suffered needlessly. Moving on, this client has even more photos to show. Here's the forehead. Before we started treatment, you can see she's got three-dimensional grooving. We'll see that in the other angle shots too. She's got activity, she's got red marks, and she's got some 3D scars over here too that are just showing themselves in a little bit of a low focus here, but you can see what's going on. This is during week 1 of the program. Things are drying up. You can start, she gets a little more focus here, and you can start to see that she does have, in fact, a lot of three-dimensional scarring on the forehead, and we're going to see how that softens up in time as well. Here, she's midway through the program. You can see some of her thickened skin has started to flake off, but she's not necessarily dry here. She just has a lot of flakes. Dryness presents with a little more wrinkly and thin skin look. This is still looking like solid, thick skin, but some of that thick skin's getting actually just flaked right off. Here she has a little bit of activity, and you can see with this angle and this focus, she definitely has some three-dimensional scars from prior inflammations in the last year. And let's take a look at her now. This is her now. You can see a remnant of the three-dimensional scars. Notice that this is a really good case for three-dimensional scars, as the softening occurs once all the color evens out and once the skin is less thick. The three-dimensional scars will soften to the eye. You'll still have some remnant of wear and tear, but you'll only be able to catch it at certain angles. You can tell, this is a pretty good shot, this is a pretty good focus, and you can see that her three-dimensional scarring has significantly come down. Despite the change in angle, change of lighting, you can still get a sense of the softening. So that was when she started, and that's where she is now. Let's get in there a little closer. And there is more. This is the mega case here. Let's go. Okay, check this out. This is her lower face. Obviously severely inflamed, uncomfortable. She's got lumps deeper in there that you can barely see. You can kind of see the lumpy stuff when you follow the perimeter of her jawline and her chin line. And here we know here we saw some deeper stuff in the cheeks too. This stuff is looking thick as well. This is obviously completely uncomfortable. You can't obviously live like this. You can't have normal social interactions in the real world when your face is on fire like this. This is obviously an incapacitating case of acne, and no, it does not require oral medications to be. Watch. This is a few weeks in. You see the crusting, some of the big ones just kind of falling off here. You still see a lot of tiny ones, and you still see a little bit of oiliness. She's still working on that. This is early on. And here she is now, 5 months in. This lower face has completely inactivated, and it's fantastic. Let's compare that. Let's get in there. It's pretty good stuff there. Let's get a little closer. Let's get on that chin. All right. This is an email I got from her recently. I've been doing so great. Thank you very, very, very much, Dr. Neal. You have truly helped me through a situation that I've had for 6 years and I thought would never fully go away. So many of my friends and other people have been telling me for the past 2 months how great my skin looks, and I've told them that I've been working hard on it in your program. Thank you for inventing the Acne Practice. You are changing so many people's lives for the better. I'm so happy when I look in the mirror and can see my actual face and not a mask of bumps. Thank you, Dr. Neal. And of course, she gave me permission to share all these photos with you. It says Dr. Neal can use my crop photos for the mission of the Acne Practice. And we thank her for this contribution, because without it, more people may still be stuck on the misconception that severe cystic acne cannot be treated topically. This misconception is broken by the contributions of this case and by the evidence that has been given to me to then give to everyone. That's the mission of the Acne Practice. You see one, you gain hope, then you get inactivated yourself, then you make one, and then you give hope. That's what she did. She would have never come to the practice without the prior testimonials showing her what's possible. And then she made one knowing that someone would see her case and see the light and see what is possible. And once you use evidence to see what is possible, there's really no room for belief. Belief is for conversations that have no evidence. If you want to talk about your beliefs in other aspects of life, that's great. You can enjoy it. It's a very imaginative and interesting conversation. This is evidence-based medicine. We're not going to use beliefs. We're not going to use claims. We're not going to use spin. We're not going to use hyperbole. We're not going to use embellishment. We're just using evidence to forward and evolve the system of medicine, to disprove misconceptions, and to move us all to a better place of wellness. Those who used to be sick, who get well, they have an inherent need to get everyone else well. And the reason is because they see the light now. And they realized before, when they were suffering, they could not see the light. I hope this body of evidence, this case and the rest of the severe cases and the mild cases and the moderate cases of every color, texture, type, hormone, whatever, I hope it is enough evidence to convince anyone that acne is a treatable condition without oral medications, and that every case is treatable, and that there are no exceptions. It has been my conclusion over the last decade that anyone who believes their case is untreatable is suffering from a different type of condition called hopelessness. The evidence-based contributions here reveal this second condition of hopelessness. Without the evidence, it may be a tug-of-war of beliefs, but the high-definition evidence have changed all of that. Please do me and the world a favor and spread this video to anyone you know who's suffering, and please email it to your doctor. It's time that every doctor understands that all acne is treatable without oral medications, and that Accutane and lasers are absolutely not the last resort for acne. In fact, many people come to this practice after failing both multiple times. Your doctor can call me anytime. If he or she wants to learn a little more about treating severe acne or persistent acne or mild acne without the use of oral medications, or without the oral contraceptive pill, or without spironolactone, or without Accutane, or without lasers, they can call me anytime and we can discuss what's been happening in this practice for the last 7 years. It's been incredible. I thank you for your contributions, and I thank you for helping me move our culture and our healthcare system forward in a dramatic fashion. I'll be here if you need me. Take care.